Skin and Body Care CE course. Today we are going to learn Model 8 skin. Skin is the largest organ of the body. Skin is the first line of defense a client has to get from heat, cold, infection. As we age, skin is becoming thinner and drier, and the loss of layer of fat just below the skin will become decreased, and the ability to stay warm will get decreased. The sweat glands, they lose their ability to cool the body. The loss of ability to feel pain, heat, and light will decrease as we age. So it's very important to promote the healthy skin. There are 5 ways to keep skin healthy. First, keep the skin clean. Second, keep skin dry all the time. And third, use moisturizer creams and lotions all the time. And fourth, encourage good nutrition. And finally, encourage mobility. Observing and reporting skin problems. When we are working with elderly people, we have to observe the client's skin whenever we are doing personal care. It's advisable to look at their client's skin at least once a day if that's possible. You can see there's a lot of problems that are coming with the skin: pressure, injuries, status vein, arthritis, ulcers, rashes, burns, and skin cancer. So generally, what are we looking for? So when we are looking at client skin, we are looking for redness, swelling, or change in temperature, a break in the skin, or can be rash or pain or odor, anything that are new for the client. Pressure injuries. Pressure injuries are very common among old adults. They are painful and debilitating, and they can lead to serious, even life-threatening infection. What are the causes of pressure injuries? Immobility is the number one cause of pressure injuries. When a person sits or lies in a position too long without moving, the weight of the body puts pressure on the skin and muscles. This unrelieved pressure cuts off blood supply to the skin. Without the blood supply, the skin eventually, the muscles under it dies and pressure injury forms. The amount of pressure needed to cause a pressure injury range from a small amount of pressure for a long time to high pressure for a short time. Pressure injuries can also be caused when the skin is weakened by different conditions like friction, too much moisture on the skin, dryness, irritation, sweat, feces, malnutrition, some chronic conditions or diseases, and circulatory conditions. What do pressure injuries look like? It depends how severe it is, but usually the first sign of pressure injury is redness for light skin people, and for dark skin people it looks like blue, red, or purple. Or sometimes we can see an open area. It might be small, like a dime, or wide as a Q-tip, or maybe it can look like abrasion or scrape, blister. It's very hard sometimes to see, but it's good idea to look at and observe clients. There are pressure points on our body that we need to take notice. These are like the bony areas. So those areas we need to relieve pressure so the clients don't get any pressure injuries. So what do we do if we see a problem? Anytime caregivers see any redness or on unbroken skin or feel heat in the area lasting 15 to 30 minutes, we need to reposition the client immediately and report to the appropriate person and document. But do not massage the area, do not use heat lamp, hair dryer, or benadine to dry it. That can cause further injury. Do not use lotions or creams that keep the skin overly moist. That can cause skin breakdown. There are a lot of skills in these chapters. The skills are listed on the back of the book on page 422 and 23. The first skill is turn and reposition a client in bed. Every client needs to be repositioned every 2 hours. A person confined in a chair or wheelchair should shift their weight in the chair at least every 15 minutes for 15 seconds and change position at least every hour. There are some tips the book mentioned in here. It says make sure there is room in bed to roll the client. Ask the client to look in a direction they are being rolled, or do not roll the client by pulling or pushing their arm. So I have a separate class about the skill. So how do we prevent friction to the skin? Friction is caused when the skin is rubbed against or dragged over a surface. Even slight rubbing or friction on the skin may cause pressure injury. So we always have to lift, not drag when we are transferring. Always have to position client in a chair or bed correctly so they cannot slide down. Or always position on a smooth linen clothing. Wrinkles can add pressure on the skin, so make sure the linens are straight. So there's some more tips about how when we're positioning a client confined in a bed or a chair, if somebody is not moving in a bed or chair, what can we do so we don't have any pressure injuries? We need to choose a position that spread weight and pressure most evenly, that's comfortable for the client. Whenever possible, we have to use pillows or wedges to keep knees or ankles from touching each other on the bed. There's a bed cradle that allows air circulation to assist in keeping the feet dry. And be cautious when you are raising the head up. That puts more pressure on the tailbone and allows the client to slide, increasing the risk for pressure injury. Avoid positioning a client directly on the hip bone when they are lying on their side. Tuck pillows behind the client's back when they are in this position. Never place pillows directly behind the knee. It can affect blood circulation or increase the risk of blood clot. Okay, I think we finished this chapter. The lesson 1. Now we're going to lesson 2, body care. There are a lot of keywords on here too for you to learn. There's a skill here, how to take care of mouth or oral care. I'll have a different class for this. But there are general tips that are listed in your book here. When assisting with brushing, use short, circular movement, gently brushing the teeth with a massaging motion around each tooth. A soft Bristol toothbrush is recommended by dentists and should be replaced when the bristles get worn. The next skill is clean and store dentures. I'll have a separate class for this too. This skill is found on page 423. There are some tips that are listed in your book about this too. It says line the sink with a washcloth or soft towel before cleaning dentures. This helps prevent breaking in case you drop the denture during the cleaning process. Allow dentures to soak overnight for several hours depending on dentist recommendations or the client preference. Inspect denture for cracks, chips, or broken teeth. Dentures can chip, crack, or break if only dropped for a few inches. They are also slippery. Take extra care to avoid dropping them. Avoid hard bristled toothbrushes that can damage dentures. Do not put dentures in hot water. Place clean dentures on a clean surface, such as the denture cup, after it is rinsed. Do not soak dentures in bleach water. Ask the client what denture cleaning products they use. Never soak dirty dentures. Always brush first to remove the food debris from it. Okay, the next one is another skill. Shave with a safety razor. I'll have a different class about this. It's listed on page 429 too. There are some tips what's listed in your book. It says do not press down hard or move the razor or shaver too fast over a client's face. Shave the side of the face first, then under the nose and mouth. Clients taking blood thinning medication should be encouraged to use an electric razor. Clean the shaver's screen and cutter regularly. It's good to clean a shaver after every third shave, or best after every shave. The next skill again is a fingernail skill. This is also listed on 423. I'll have a different class about this. But when you are doing a finger care, go from one side to the other in one direction only, or file each nail tip from corner to center. Moving back and forth with an emery board and going too deep into the corners can split and weaken nails. Cuticles act as a barrier to infection, so do not clip them. Offer to apply moisturizing cream or lotions to the hands and cuticles after you're done. The next one is foot care. It's another skill. Inspect the client feet regularly for changes in color. Monitor minor cuts and keep them clean. Do not put lotion in between the toes. For most clients, you'll only be filing nails, not clipping nails. Never clip toenails for a client with a circulatory problem or diabetic. Do not cut down the corners of a client toenail or dig around the nail with a sharp instrument. Cuticles act as a barrier to infection, so do not clip them. Another skill again, assist a client with a bed bath. Bathing may happen in a shower, bathtub, bed, or sponge bath. Ideally, the bathroom should have maybe a bath mat, bed bench, handheld shower, grab bar. They have different kinds. The tips that your book gave us in here is when assisting with the bath, start at the client's head. Work down and complete their front first, unless the client has another preference. Use less soap. Too much soap increases skin dryness. Fragile skin requires a very gentle touch. Make sure lighting is good. Make sure the bathroom is warm and without any drafts. So for a showering tips, We have some showering tips in your book. Make sure the floor is dry when assisting someone in or out of a shower. Make sure all equipment is secured and locked before assisting someone on or off the equipment. Encourage the client to do as much as they can. If help is needed, make sure to move body parts gently and naturally, avoiding force and overextending limbs and joints. When assisting a client off a bath bench, make sure the person is dried off well so they don't slip. Look for skin problems, especially at pressure points and feet. Shower rooms and bathrooms are high risk areas for falls generally because they are wet. Stand behind or beside a client while you are assisting them to walk. Never walk in front of a client who's using a walker. This one is assist client with a weak arm to dress. I'll have a different class for this too. It's on page 425. Clients who need assistance with dressing often have difficulty doing things that require small finger movement like buttoning, zipping, putting on socks, and or lacing up shoes. It's very interesting that there are many helpful tools to assist a person to dress independently, like Velcro in place of buttons or shoelaces, or zipper pulls that are attached to a zipper metal tab to give the client added leverage in closing and opening the zipper. Extended shoe horns that allows the client to get on their shoe without bending over. And the type of clothing is very important too. There are certain type of clothing that can make it easier for clients to get dressed, like pants and skirts that pull up or on, items that fasten in front, including fastening bras, blouse, skirt, and pants, or clothes that made of fabric that stretches, or Velcro fasteners and large flat buttons that are easier to open and close. Generally, choosing clothing is very personal statement. Clients need to choose what they want to wear. This is another skill. Put a knee-high stocking on a client. Client with poor circulation to the feet or swelling due to fluid in the tissue might wear elastic stockings. These are typically ordered by the client doctor and they are required special consideration when washing and drying them so they don't stretch out. There are some tips that are given to us in the book. Encourage the client to have you assist with putting on elastic stocking first thing in the morning before leg swelling get worse. Encourage the client to let you put the stocking on while they are in bed before they get out. Make sure that the heel of the stocking is in the correct place. And make sure to check the stocking frequently for wrinkles after the client is dressed. Wrinkles in the stocking can cause pressure injury and lead to skin breakdown. Passive range of motion. This is another skill. Range of motion exercise help a client's joints flexible and strong, reduces stiffness, and increases the range of motion in a specific area. When clients are unable to move their bodies independently, they will need you to assist with passive range of motion exercise. It's like active range of motion and passive range of motion. There are some tips that are listed in your book again. Encourage the client to relax during the exercise. Perform each exercise slowly and consistently. If the muscle seems especially tight, slowly pull against it. Move the joint gently to the point of resistance. Stop if you see sign of pain on a client's face or the client report feeling pain. Depending on where you work, additional training may be required before assisting a client with full range of motion exercise. Thank you very much.